Welcome. I'm your host, Dr. Sonia Johnson. Okay, so it's waiting on some people to join us, and I hope you had a wonderful weekend. Okay, Christmas is around the corner, literally, so I'm sure you're doing your last minute shopping. Celebrated mine this past weekend. It was really nice, so the stress is gone. I'm not saying there was any stress anyway. I guess that's why we like to celebrate it on different days, so less stress. Anyways, okay, so let's get started. If you want to share the screen, just press the button at the bottom of the screen. As you know, sharing is caring. And if you have a friend that you want to hear this message, just tag them. Okay, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. Okay, so today we're going to talk about procedures and the adverse reactions that happen with getting hair laser removal. So as you know, you can get the little devices that are sold on the television now. And of course, if you go into a spa or a medical office, such as a dermatologist office or a plastic surgeon office, they offer hair laser removal. Now, like I mentioned in previous lecture, hair laser, there's different lasers you can use. And of course, depending on the skin type, your Fitzpatrick type, that certain lasers work better than others. But regardless, you can still have the same outcome. End of the day, the goal is to diminish the number of hairs that are grown, that you grow rather, and also to not to have to shave as often. So you're going to still have some hairs, but not as much, okay? And as you're getting your treatments done, you know, I'm sure the technician will probably try to increase the joules if they can without causing any adverse reactions. But as we know, for some people, if they go bake in the sun, that causes increased tanning of the skin, and therefore that can cause one to have adverse reaction to the laser. For women, we find that around their menstruals, they're a little more sensitive. And that's not an adverse reaction, but they can't tolerate the increased joules that sometimes is used, or the setting that they normally can tolerate around their menstruals, they cannot tolerate that. And then the technician need to dial down the settings. And if not, they can have an adverse reaction. So the adverse reactions include mainly, of course, burning. And what we've seen is you need to make sure your skin is clean. So if you have products on your skin before a laser treatment, especially if it's a product that has oils in it, mineral-based makeup, something that you can't see, or moisturizers on your face, you want to make sure your face is clean, or whatever area you get treated is clean before you have the laser removal performed. Because if not, that heat from the hair laser can cause the mineral base or any type of oil that is in the products that's on your skin, can cause it to increase in temperature, and it stays around. So it actually causes a burn. So that's the main reason why people get burns. Number two is the settings are too high. For whatever reason, the settings that is used, one thought maybe that would be a good setting for you, but it's not, it's too much. Or you've been exposed to too much sunlight, and now the setting, you need a lower setting, and that's not the case. You tend to continue the same setting as too much. So all those reasons can lead to an adverse reaction such as a burn. Now, when it happens, you treat it as a first-degree burn, and in which you clean the area, you keep it moisturized. I like to use ointments-based products, and to make sure and keep it moisturized, because then your pigment will come back faster. But if you notice, if you notice it at the spa, of course, they would take care of it. Or if you're at the setting of doctor's office, whatever, you notice the adverse reaction, definitely to be handled at that moment. But let's say you go home and you just notice you're still more sensitive than normal. Definitely ice will help you a lot, because the ice pulls the heat out of that area. And, if you have some Cordate or something, that will help. But if that's still not enough, you want to definitely call the location back that you had the procedure performed, and they will go from there. You know, make some recommendations, have you to come back in, but regardless, they would take care of the situation. Now, one thing about hair lasers, if you do get a burn in that spot, well, that spot does very well with getting rid of the hairs. So sometimes the hair just don't grow back at all. But of course, that's not the way you want to go about it. So, you know, the concern is make sure you don't have any scarring, which I've never seen that, you know, or heard of that, where a person is permanently scarred and the skin tone never returned back to normal. I've never read that, but anything is possible. And of course, besides the burn that can, that's the major problem that can happen. Other things that can happen is you use a product that is irritating to the skin after you have the hair laser performed. So again, be very careful with what the products you're using. You do not want to use vitamin C containing products or exfoliators or benzoyl peroxide containing products prior to hair laser removal. And definitely you want to wait a couple of days after the hair laser removal to have that done. And of course, any retin-A products, which is an exfoliator, products of that sort. So all those products can cause problems with getting a hair laser performed and interfere with your ability to tolerate the heat from the hair laser. And if you can't tolerate it, it may lead to an adverse reaction. So any questions? But great. Thank you. I'm your host, Dr. Sonia Johnson, board-certified dermatologist and creator of the gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, again, like I stated, you're at the right place. We do have a product that after laser, you definitely want to wear sunscreens. So, you know, of course, now it was sunny today in Indianapolis, but where you are, not for sure, but if you have a hair laser and there's a lot of sun out, you definitely want to cover up with some type of sunscreen. And if you're interested, we have a neat Triple Defense Sunscreen that is really nice. It's not too heavy, and it blends in very well with the skin, but it does an awesome job of protecting the skin, and it lasts a long time. So it lasts about 80 minutes, which is really good for sunscreens, instead of your typical 30 minutes. So if you're interested, go to yes.gorgeousSkinNow.com. Yes.gorgeousSkinNow.com. Take care. Have a wonderful evening. Bye-bye.